In the case of People versus Conrad Robert Murray, Dr. Murray is present with his counsel, Mr. Chernoff, Mr. Flanagan, Mr. Gorgian, and Mr. Pena. The people are represented by their counsel, Mr. Walgren and Ms. Brazil. All 12 jurors and the alternates have joined us and are present. To everybody, good morning. To the jurors, good morning, ladies and gentlemen. Nice to see you. At this time, we're going to resume with the presentation by the defense. And Mr. Chernoff, good morning. You may call your next witness.
Thank you, Judge. We're going to call Gerry Causey.
Please raise your right hand. Do you solemnly state that the testimony you may give in the cause now pending before this court shall be the truth, the whole truth, and nothing but the truth, so help you God?
Yes.
Please be seated. Please state your name for the record. Spell your first and last names.
My name is Gerry Causey. Gerry Causey.
Mr. Causey, good morning.
Good morning.
Let me provide you with some introductory instructions that I give to every witness in every case. The first instruction is to please sit back and relax. The second instruction is to speak in a loud voice, and that way everyone can hear you. The third instruction is to answer a question yes or no if it's called for, rather than using slang like which can be tricky. The last instruction, Mr. Causey, is to wait until you hear an entire question before you even start to answer it. In our everyday lives, many of us are used to speaking over each other because we think we think we know what the question asks. But in a courtroom, it's important to simply wait, hear the whole question, and then respond to it. Is all of that okay?
Yes.
Thank you. Direct examination, Mr. Chernoff.
Thank you, Judge.
Thank you.
Mr. Causey, how are you this morning?
I'm fine, thank you.
You nervous?
No.
No?
No.
All right. Mr. Causey, where do you live?
I live in Cedar City, Utah.
All right. And how did you get here today? How did you get to L.A.?
I drove.
Sure. Do you know this gentleman sitting to my left here?
Yes.
Dr. Murray?
Yes.
Indicating the defendant, Dr. Murray.
How long have you known him?
11 years.
11 years. Where were you living 11 years ago?
Las Vegas, Nevada.
Okay. I want to talk about the circumstances about how you got to know Dr. Murray. What happened 11 years ago that precipitated you meeting Dr. Murray?
I had a heart attack.
Okay. Can you give us some idea about how that occurred, where that was when that occurred?
I was at home early in the morning, approximately 4 o'clock.
Okay.
And they transported me to University Medical Center.
Okay. And when you got there, what occurred there?
They couldn't stop the heart attack. Then they called in Dr. Murray.
All right. And prior to that time, you had never met Dr. Murray before?
No.
All right.
Double negative.
Prior to 1999, you had not met Dr. Murray?
No.
Is that correct?
That's correct.
All right. And what happened next?
He talked to me for a few minutes, told me the procedure that he was going to have to do, made sure that I understood exactly what I was going to go through. They had me sign some paperwork, which was, I think, a release or something to that effect. Then they took me upstairs to the operating room.
What procedure was going to be done?
He was going in through an angiogram and check and see what was causing the problem.
Okay. Now, at that, prior to going to the hospital, had you known that you had heart difficulty?
I had high blood pressure.
Had you
I
ever,
knew that, and I took medication.
had you ever had any indication that you were going to have a heart attack or any problems with your heart?
No.
So this was quite a shock. This was a shock to you.
Yes.
Were you scared?
Yeah. Yes. Yes.
How old were you at the time, Mr. Conrad?
57.
Okay. Tell us about the procedure that occurred.
They didn't knock me out. I didn't want them to do that.
They didn't, I'm sorry, repeat that?
They didn't sedate me. They give me pain medication, but I wanted to be awake to watch the procedure.
Okay.
He let me do that.
Mr. Causey, when you say you were not sedated, you were not knocked out. Is that what you're saying?
That's right.
All right.
Yes.
But you did receive certain medications to calm you down. Is that right?
Yes.
But you stayed awake.
Pardon me?
But you stayed awake during the procedure.
Yes.
All right. And what occurred during the procedure?
I watched him go up through my veins and arteries, find the problem. He told me he had found the problem. And the second that he put it in, there was no more pain.
Did you see that on the screen while that was happening?
Yes.
Did Dr. Murray explain to you what the process was and what the procedure was that he was doing?
Dr. Murray always explains everything.
Now, after the procedure, you would have, can you tell us, did you receive a stent during that procedure?
Yes.
How many stents did you receive?
One on that occasion.
Okay. After the procedure, did you have any follow-up visits with Dr. Murray?
Yes.
Okay. And how soon afterwards did you have that follow-up visit?
2 months. February.
Okay. And when I say follow-up, I mean go to Dr. Murray's office.
I had gone to the Dr. Murray's office. I think it was approximately 3 weeks after the procedure, first procedure, and he set me up for the second procedure.
Okay. And did he perform that second procedure as well?
Yes, he did.
And Mr. Causey, this was 10 or 11 years ago. Have you remained in contact with Dr. Murray?
Constantly.
And we don't want to go into things that Dr. Murray would have said to you or you said to him while this case is going on, okay? So focus on my questions. I'm going to be direct. But why the constant contact?
You can ask a leading question in this regard, focusing on the issues at hand, please.
Was the constant contact, was it because of your medical condition?
Partly, yes.
And what was the other part?
My friend.
Now, after your heart attack, after your stents were put in, did you develop a friendship with Dr. Murray?
Yes.
Okay. And that friendship has lasted till today?
Till today.
Now, you've had other doctors in the past, have you not?
I have.
And you've developed friendships with them as well?
No.
Well, why Dr. Murray?
It's because of Dr. Murray. The way he cares for you, and the way he makes you feel, and the concern, and the love for you he has for you.
There have been allegations in this trial. Have you been watching this trial, Mr. Causey?
Some.
There have been allegations in this trial that Dr. Murray abandons his patients.
No.
Do you have an opinion about that?
Objection. The state's testimony. The testimony is he abandoned Michael Jackson.
The objection is, well, that may or may not be the case. The objection is overruled. You may answer it.
Would you repeat the questions, please?
Do you have an opinion about whether Dr. Murray has the type of character to abandon patients?
Never. He would not do that.
During the time periods that you visited Dr. Murray's office, did he rush you in and out and during the process, like some doctors might?
No, he took probably more time than he should. I've been in Dr. Murray's office on appointment 4.5 hours. And as a doctor-patient and as a friend.
There have been allegations made that Dr. Murray does not inform patients about their process and procedures that they're going through.
The objection is sustained. Ask the question.
Do
Thank you.
Do you have an opinion about whether or not Dr. Murray is thorough in his discussions with patients about the dangers and process and procedures of their treatment?
Yes.
What is that opinion?
I don't think you could ever be too thorough, but he will spend the time that it takes. And he does it in, I call it layman's terms, okay, because he'll do it so that you perfectly understand it. He will let you ask questions. While you were there, he will call your family, make sure that they understand, and call my wife every appointment and told her exactly what what I was going through.
Do you have an opinion about whether Dr. Murray is motivated by money, that he's a greedy man? Do you have an opinion about that?
Yes.
And what opinion is that, Mr. Causey?
There's no way. He's not greedy. I
What do
mean, he doesn't charge me my deductibles or nothing. He never has. I've sent patients to him, my employees, my secretaries, that he didn't even know if they had insurance, and he took care of them.
There was a time when you were treated, you had insurance, didn't you?
Yes.
Okay. And you're on Medicare, is that right?
I am now.
Okay. All right. When Dr. Murray, were you aware of when Dr. Murray took a job with Michael Jackson? Were you ever informed of that?
Yes.
Did you feel abandoned by Dr. Murray as a result of that?
Sustained.
What do you have an opinion about whether Dr. Murray abandoned his patients?
Objection asked and answered, Your Honor.
Sustained.
How did you become aware that he was taking the job?
He called me to his office and told me the position he was going to take. He told me that he would be back. He told me that he had made arrangements for me to have care. I have all of his phone numbers. Told me to call him anytime, and he would take care of what I needed.
Thank you for coming up here, Mr. Causey. That's all I have.
Mr. Chernow, thank you. Cross-examination by the people.
Thank you,
Mr.
Your Honor.
Walgan.
Good morning, sir.
Good morning.
Mr. Causey, when did you drive out to Los Angeles?
I have a problem here in...
I'm sorry. For purposes of your testimony, when did you drive out to Los Angeles?
I came down Monday night.
And you're staying in a hotel?
I did just yesterday, yes.
You've given a number of media interviews regarding this case, correct?
Say that again, please.
You've given a number of media interviews regarding this case, correct?
I have given 2.
Were you still being treated as a patient by Conrad Murray in 2009, or was your relationship social and as friends?
In 2009, I tell you, I cannot remember, but definitely friends. I can't remember the last time Dr. Conrad seen me professionally.
Can you give us a year, approximate year, that he saw you professionally?
It was 2008, 2009, but I would say 2008.
So when was it that Conrad Murray informed you that he was going to be leaving his practice and being the personal physician for Michael Jackson?
It was right before he left us to go to Michael Jackson.
Can you give us a month?
I cannot.
Could it have been around April 2009?
Could have been.
And you're not just a friend of Conrad Murray. You actually described him in your statement to the defense counsel as your best friend, right?
He's my best friend.
You email him via personal email accounts, correct?
No, I do not email him.
I think you said you have all his phone numbers and you talk to him on his personal cell phone.
Yes.
Now, when you were first treated by Conrad Murray, this was for a heart condition.
Yes.
Okay. Had nothing to do with a sleep disorder, correct?
No.
Had nothing to do with
Double
any...
negative.
Is it true that it had nothing to do with a sleep disorder?
Yes, it is true. Yeah.
And is it true it had nothing to do with any type of drug dependency issue?
No.
And when you first met him,
Could you
that was in a hospital.
I'm sorry,
correct?
you want something cleared up?
Yes, sir. I would like him to repeat the last question, please.
I'll ask the court reporter. The question was, did it have anything to do with a sleep disorder?
No.
Drug dependency?
No.
I think that was the last, wasn't
Thank
it?
you. Yes.
Okay, thank you.
And when you first met him, you had a heart condition. This was in a hospital, correct?
Yes.
And before going into the procedure, Dr. Murray explained to you what was going to happen,
Yes.
and he had you sign some paperwork.
The hospital did.
You signed some paperwork.
Yes.
And this was about 11 years ago, correct?
Yes.
During the procedure, you looked up and you could see the monitors in the room. You indicated you looked up and saw that, correct?
I asked to watch it. Yes.
Yeah. And you said you looked up and you could see the screen showing what your heart was doing, correct?
Yes.
Okay. Had lines on it and showing the rhythm of your heart and your oxygen saturation, things of that nature, correct?
Yes.
How many other people were in the room other than Conrad Murray?
I think 3.
3 additional people?
Yes.
So 4 people in a hospital room with the monitors doing this procedure, correct?
Correct. Yes.
And all of your, I guess that was the initial single stent. Is that accurate?
Yes.
And then I may have misheard. Were there additional stents put
Yes.
in?
Yes.
Okay. And those were all done in a similar circumstance in a hospital with the equipment and personnel, correct?
Yes.
And it all related to a heart condition.
Yes.
You want to clarify something,
I would like to clarify
Mr.
something.
Walker?
Please.
My heart is good. Okay. I have a good, strong heart. I have real bad veins and arteries from cholesterol.
Okay.
So
But-
that created the heart attack.
Okay, but everything Dr. Murray did for you related to putting stents so your heart would function properly.
Yes.
Okay. Thank you, sir.
Mr. Walgren, thank you. Mr. Chernoff, redirect exam.
Mr. Causey, the media interviews you did, were you paid for those?
No.
Why did you do them?
To help my friend.
Well, why did he need that?
To help my friend.
Why did he need that help? What was the problem?
Excuse me. I didn't-
Why did he need that help, Mr. Causey? What was the problem?
Objection relevance, Your Honor.
I'm going to sustain the objection.
Mr. Causey, had you been seeing the press prior to doing your interviews? Had you been seeing the press reports about Dr. Murray?
Objection relevance, Your Honor.
Just a moment. You can ask, I'm going to sustain the objection, can ask the witness to explain the basis for his giving any interview. You can rephrase.
Thank you, Judge.
Thank you.
Can you explain the basis for your decision of why you decided to give these interviews?
Objection, Your Honor. It's been asked and answered. He said to help his friend.
Overruled. You may respond if you like.
The reason I decided to help, or to come and help Dr. Murray if I can, is I've known him, I know his love, compassion, his feelings for his patients. You can ask every one of them, and they will say exactly the same thing. He's the best doctor I've ever been to because of the treatment, because of the clarity of what he's doing, and the follow-ups. And I just don't think he did what he's being accused of, and I wanted to help.
Okay, I have no other questions.
Thank you, Mr. Chernoff. Recross, Mr. Walgren?
Yes, please, Your Honor.
Thank you.
There's nothing in the world or any piece of evidence that would cause you to change your mind about Conrad Murray, correct?
I'm not going to say nothing, but
Well, you don't.
what I know right now and what I feel, he didn't do it.
And if you assumed, I want you to assume, okay? I want you to assume that Conrad Murray acted with gross negligence in this case and caused the death of Michael Jackson, okay? You would still be here giving this testimony to the jury, correct? For your best friend?
I would be here, yes.
Thank you.
Walgren, thank you. Mr. Chernoff, redirect? No, Judge. Thank you. May Mr. Causey be excused, Mr. Chernoff?
Yes, of course.
Mr. Walgren?
Yes, thank you, Your Honor.
Thank you. Mr. Causey, I want to thank you for your testimony, sir. Please don't discuss your testimony or the facts of the case with any other witness until we finish the trial, and you may step down and leave, sir.
Thank you very much.
Thank you.